Hello there. My name is Gabriel Ortigoza, and I am your facilitator for today. And we have this burning issue, and we'll be talking about COVID-19. What is COVID-19? So that will be our goal today, to know, understand what is COVID-19, what are the signs and symptoms of a patient or a person infected with COVID-19, and of course the measures that we can do to prevent the infection or get infected with coronavirus. Now, just a background. Currently, today is July 4th, 2020, and the cases of coronavirus around the world is about 11 million or more than 11 million, and there are already more than 500,000 people died because of coronavirus. In the US, the infected cases of coronavirus is at about 3 million people, and the people who died because of coronavirus is about 130,000. And we have also a daily record of infected persons with coronavirus. This week, we have more than 50,000 per day of infection, and the number is going up. And that is because the economy is open, people coming out, and they're going to crowded places. And let's see, what is this coronavirus, how we get infected with this virus. Let's proceed with our first slide for today. And it says here, life is never the same again since this virus came into this world. Yes, that's right. We used to go out anywhere, anytime, but now our movement is restricted. Why? Because of this infection. The state government is advising everybody to stay home. If you don't have nothing to do outside, avoid infection, avoid crowded places, stay at home. That is one way of preventing coronavirus infection. On January 7, 2020, the World Health Organization named this virus Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2. This is the latest name of this virus, because we know there are coronavirus in the past, and we will learn on that later on this topic. Now let's go to history, brief history of coronavirus. On the 11th of January 2020, the WHO named this viral disease as coronavirus disease 2019, or in short, they call it COVID-19. So that's the meaning, the shortcut of coronavirus. The SARS-CoV-2, or the coronavirus 2, or the COVID-19, is the third coronavirus since 2002. The first SARS, or coronavirus, in 2002 was the SARS, or the severe acute respiratory syndrome. And this virus originated in Guangdong, China. And the researcher found that it came from bats. Now, the second virus of this kind is the MERS, or MERS. This is called Middle East Respiratory Syndrome. And it was discovered in Saudi Arabia. That was in 2012. And the third one of this type of virus is the present coronavirus, or the COVID-19. And it was discovered in Wuhan, China. Wuhan is located in Hubei province in China. And Wuhan is a big city. There's a lot of people, there's a congestion, There's a lot of people everywhere. On January 13, 2020, the World Health Organization identified the first international case of coronavirus in Thailand. So from Wuhan, China, the first infected person traveled from China to Thailand. And this person is a woman who is a traveler, or who traveled from Wuhan, China to Thailand. And after that, people travel from different places. They bring infection with them, um, infection to the region, bring infection to the continent. And now the coronavirus is all over the world. That is why they call it pandemic. It's more than it's located in more than 2 continents or region. Now, what are the signs and symptoms of coronavirus? First, fever with a temperature of 100.4 degrees Fahrenheit or above. Normal temperature is 98.7, more or less in that area. And tachypnea, that is called a fast breathing. Normal respiratory rate is 12 to 20. If your breathing is more than 20 or in the 30s or sometimes 40, then most probably you have this infection. And remember, the fever and the breathing is under the signs of this infection. The one you can see is the sign. Now, the one you feel, subjective, is the symptom. And what are these? These are generalized muscle pains, nausea, you have the feeling to vomit or you're nauseous, fatigue, you are winded, you're gassed up, you're easily tired, you're getting fatigued, chills, or you have a shivering, cough, sometimes productive, sometimes non-productive cough. And then you have headache. It's a severe headache. We have patients who describe it as, for the scale of 0 to 10, it's always 10. The headache is very severe, that they feel that their skull, their head will crack. And also another symptom is sore throat. Coronavirus attacks the tissue in your respiratory tract, and your throat is part of the respiratory tract. And remember, this virus attacked the respiratory system, including the lungs. And then next symptom is loss of taste. And the last one is loss of smell. Remember, the loss of taste and the loss of smell are very specific to patients with coronavirus infection. So loss of taste and loss of smell. And these symptoms cannot be seen on other viral infected patient other than coronavirus infection or COVID-19. COVID-19 is classified or categorized into 2. It's a mild infection if the illness lasts within or about 10 days. And then it is categorized as severe infection if the illness is about 2 weeks or more, stays longer, and patient gets very sick on severe type of coronavirus infection. Now, the incubation period for SARS-CoV-2 or COVID-19 is from 2 to 14 days. So remember, when they tell people to go quarantine, at least they quarantine for 14 days. The government or the public health would like to make sure that you do not develop symptoms within 14 days to make to keep you isolated for the period of time, to make the environment or the community safe. Unless you get infection, then within that 14 days quarantine, you develop symptoms and signs, then the public health can make some measure to treat you on your symptoms. An infected person can infect others 2 days before the manifestation of the disease. What does it mean? It simply means that if you manifest infection today, like you have symptoms of generalized body malaise, fatigue, you have chills, or you have signs of fever, and you have tachypnea today, you count 2 days backward, yesterday and 2 days ago, that maybe you were with other persons, or you are in close proximity with other persons, with other people. So they need to be identified also, because they might be infected by you. And the public health wants to know that, because it is a very important part of contact tracing. So we can isolate, we can quarantine those people exposed to an infected person. So that is 2 days backward if you get infection today. Now, there are also people who are asymptomatic, meaning they don't have signs and symptoms of infection, but they are infected. So they function naturally, they go to anywhere they want, and they don't know they're infected. And the problem with this is they can infect others. So if they're in a crowd and you happen to be there, you might get infection. So this is what we have to remember, put in mind, that precautionary measure, avoid going to crowded places, density, so we can prevent infection. And it says here the contagion lessens with time, meaning the communicability of the disease or this COVID-19 lessens with time. So if you get infection today, you manifest your signs and symptoms for the first time today, as time passes by, your immune system is building up and you are fighting back the infection, and the contagion lessens with time. And you are on that path to healing. Now, let's go to the risk individual. Who are the high risk individual? Of course, we always hear from the news or TV that those people with age 65 and above are high risk for coronavirus infection. So the advice is for those senior people in the community, if they can avoid a crowd, please avoid a crowd. And if you cannot do that, go ahead and wear your mask. This is very important. It will protect you and it will protect others or your loved ones. Another high-risk individual is the people with obesity. So how can we say that the person is obese? Usually it is based on your BMI, or BMI is body mass index. And the normal number for BMI is 18 to 25. If your BMI is between 18 or 18.5 to 25, then you are considered as normal weight. If your BMI is 25 to 30, then you can be categorized as overweight. And if your BMI is 30 and above, then you are considered obese individual. How do they measure BMI, the body mass index? So the BMI is measured by your weight in kilograms divided by height in a square meter, and then you will know your BMI. Or just Google your weight, Google it, and then you can see the result in the computer. Here's another one. existing medical conditions is also high-risk individual. And those people with diabetes, with heart disease, with lung disease, with liver disease, with kidney disease, high blood pressure, and weakened immune systems are individuals who are high risk. Now, question, if a person with AIDS or uh, acute AIDS, autoimmune disease, or AIDS, people with AIDS, are they considered weakened immune system? According to Johns Hopkins University, the individual with AIDS who are under treatment and there's no sign and symptoms of infection and they're functioning well, then they're considered not under weakened immune system. They're okay. So those are the high-risk individuals for coronavirus infection. And remember, young people are not exempted. They get infection too. So before, they thought that this coronavirus is only a disease for the elderly. But now research says that any individual exposed to coronavirus can be infected. So again, for young people in the community, take extra precautionary measure in going out because you can be infected also. Now let's go to diagnostic tests for coronavirus. According to Johns Hopkins University, there are two diagnostic tests for coronavirus. The first one is the PCR, or what they call this polymerase chain reaction. It is a test that detects RNA. And how is it done? It's done through swabbing. So we get a swab, we put the swab through your mouth. It's called the oropharyngeal swabbing. And then we do the swabbing to your nose, and we call it nasopharyngeal swabbing. In that swab, we send it to the laboratory, and we look for the specimen if it's if there's a presence of RNA. And if there is a presence of RNA, the result comes back as positive, meaning you are COVID positive. But sometimes the process of swabbing is not done properly. It was erroneous, and the patient or the person has signs and symptoms of coronavirus, but the result of the test is negative. We call it false negative, meaning the process of swabbing was erroneous or it was done properly, and there was no RNA in that specimen swab. So the laboratory cannot find it. And then we sometimes do the repeat swabbing if the patient continue to manifest signs and symptoms of similar to coronavirus. The other test is called the, or by the way, the PCR test is also called molecular test. So sometimes they interchange the name. PCR, polymerase chain reaction, or molecular test is the same. The second test for coronavirus, according to Johns Hopkins University, is the antibody test. The antibody test is a blood draw. And IgG, or immunoglobulin G, is the most common antibody found on that blood draw. And if you have IgG in your test, most probably you were exposed or have been infected with the coronavirus, and your body immune system were able to fight it out. And you don't feel it because you were asymptomatic. You recovered. Your immune system is good, strong, and you recovered from the infection. Now, just remember, there are two types of diagnostic tests for COVID. the one that we use the swab through the nose or through the mouth, and the one that we do a blood draw to check for the antibody. Now let's proceed to this morbidity and mortality according to CDC, or Center for Disease Control. Now, 2 to 5% die for those 65 to 75 years old. If your age is within this age bracket, then there's a chance that 2 to 5% will die. If there are 100 patients with coronavirus, 2 to 5% of patients with age 65 to 75 will die. This is according to CDC. And 4 to 10% die for those 75 to 85 years old. And more than 10% die for those people age 85 years old and above. So if there are 100 patients aged 85 years old and above, 10% of them will die because of coronavirus infection. Now, the death is rare among young and healthy people. Why is this? Because young and healthy people can manage to recover because they're healthy and their immune system is good. Now, how can we boost our immune system? Through good, clean diet, healthy diet, exercise, and sleep at least 6 to 8 hours a day. For exercise, you can spend at least 1 hour a day walking or do interval exercise. And you can do it like every other day, or you can max it 5 times a week at 1 hour per day. It's a good exercise. Do it slow, so you won't develop this muscle or muscle pain if you're starting to do the exercise. That is one way of boosting or making yourself healthy. The risk of death is dependent on accessibility to healthcare. Yeah, this is very true, because if you have health insurance, especially in the US or in other parts of the world, then you can go see your doctor and you can be checked, tested, diagnosed, and treated. Early diagnosis is a very important factor in the treatment of a patient infected. There are people who don't have health insurance, and sometimes it's very hard for them to go to the hospital because of financial issue or problem. I remember in the Philippines, people just die without seeing a doctor. Why? Because they have to spend their money out of pocket because they don't have insurance. And you have to pay personally your hospital bills, and it's very expensive. So your survival is also based on healthcare accessibility. There is no treatment yet for or vaccine for coronavirus, but the NIH, the National Institute of Health, is already using this remdesivir. It's antiviral, and this is under emergency use authority, and they're authorized, the infectious disease doctors are authorized to prescribe this medication to the patient diagnosed with coronavirus. And hopefully the final process of the study will be done, and we can have antiviral medication for coronavirus infection. And also the pharmaceutical company all over the world is in a hurry to find a vaccine and pharmacological treatment for coronavirus infection. Hopefully we can have those medications and vaccine soon, so we can go back to our normal lives. Now we are in a new normal, wearing masks, social distancing. So far, for the treatment of COVID-19, is supportive. For example, if you develop infection and while having infection, you develop secondary infection like pneumonia or other bacterial infection, then sometimes you are diagnosed to have COVID-19. The medical doctor attending to you will order antibiotic for bacterial infection. Remember, the COVID-19 is a viral infection, so we need antiviral medication for that. For bacterial infection, we need antibiotic for the treatment of those diseases. Now, a few days ago, Dr. Anthony Fauci, the infectious disease in the United States, mentioned that there is a new strain of coronavirus. And the research pointed that these strains originated in Italy. So remember, the coronavirus came from Wuhan and infection went to Europe and to part of the world, New York, and other part of the world. And now there's a new strain of this coronavirus. It mutated. And our researchers are studying how strong, how infectious this new strain of coronavirus. And we're still looking for the treatment for that. Hopefully soon we have vaccine and antiviral medication for coronavirus. Now, what are the general advice that we need to follow while waiting for medication and vaccine for COVID-19? According to CDC, we have to follow the social distancing, meaning at least 6 feet apart. Avoid density, avoid crowded places like church. Every Sunday, I usually go to church every Sunday or every other Sunday because I work every other Sunday, weekend. For now, because of this pandemic, I try to avoid going to church. I try to avoid going to theater or crowded places because we don't know if somebody in the group is infected with coronavirus. So to avoid those infection, prevention is very important. Avoid going there. Then wear a mask. Mask is very helpful. If you are wearing mask, you are being prevented from putting your droplet to the environment. And your environment is composed of people and other people, other person around you. And mask is helping you prevent droplet coming from your mouth or droplet coming from your nose to infect others. And also we have a advice from the CDC, which is a proper hand washing. And avoid touching men, MEN, meaning avoid touching your mouth, your eyes, and your nose, because we don't know if our hands are clean or no, or our hands carry the virus for COVID-19, and we touch our mouth, we touch our eyes, we touch our nose, and we infect our mucous membrane, and then we get infected. And then the general advice for people is stay home if possible. If you have nothing to do outside, stay home because this will prevent the spread of infection. Remember, coronavirus is a virus and it does not have feet. It doesn't walk to anything, to anywhere. And the person, the host, is the one carrying the virus. So to avoid infection, let's follow general guidance set by these CDC. And it was proven that these guidelines lower or bend the curve. Now the curve for coronavirus infection is going up, rising again. Why? Because of the economy is back to its function. Now we're like stepping forward, and now we're stepping backward. Open the economy, close the economy because of infection rate going up again. So until we have a vaccine, until we have antiviral medication for COVID-19, then let's follow the non-pharmaceutical method of preventing the infection. And thank you for your time, and God bless you. See you on my next video.